They don't want it perfect. See, the good folks over at Gillette, and I know them well, they can fabricate a razor capable of lasting a lifetime. But they don't. And Energizer, well, they can build a battery that can keep on going and going and going. But they don't either. Now, point is, when our product, New Blood, goes to market, we don't want it to work too well. We want it to be a healthy habit, not a cure. You follow?
The shorter the half-life, the greater the profit.
Amen.
Imagine living in undiagnosed pain your whole life. Your joints dislocating when you roll over in bed. Your skin bruising from a simple handshake. Your heart racing just from standing up. And every doctor tells you it's just anxiety, or that you're double jointed. That's the reality for thousands living with Ehlers-Danlos Syndrome, a genetic connective tissue disorder that causes serious disability. Ehlers-Danlos Syndrome, also known as EDS, is massively underdiagnosed. Studies show that it can take over a decade for a patient to get a proper diagnosis. And because it's barely covered in medical schools, some doctors can't even pronounce the name, more or less diagnose it. And some even dismiss symptoms as stress, depression, or hypochondria. Some patients are even labeled as malingerers, accused of faking symptoms for attention or benefits. That label follows them in their medical records, poisoning every future doctor visit. Meanwhile, their condition keeps progressing, with more dislocations, more pain, and more irreversible damage. And here's where it can get a little dark. Some people believe that it isn't just ignorance, but that acknowledging EDS means acknowledging a lifetime of care, expensive surgeries, medications, and disability claims. And that's something insurance companies, and sometimes even healthcare practitioners, aren't eager to take on. Whether it's systemic neglect or something more intentional, one thing's clear. People with Ehlers-Danlos Syndrome deserve answers, respect, and competent medical care. Listen to your patients. Listen to your family members. Believe them. And if you have Ehlers-Danlos Syndrome, your pain is real, your symptoms are valid, and you deserve to be heard. Ehlers-Danlos needs more awareness, more funding, more research, and more treatments. There's so little that can be done right now for people that are suffering from Ehlers-Danlos Syndrome. Ever wonder why Ehlers-Danlos Syndrome has a zebra for their mascot? It's not just because they're cute. In med school, they say, when you hear hoofbeats, think horses, not zebras. Meaning, look for the common illness first. But here's the problem. Sometimes those hoofbeats are zebras. Ehlers-Danlos patients are the zebras of medicine, rare, overlooked, and often misdiagnosed for years because doctors aren't trained to spot us. The zebra says, we exist, we're real, and we deserve to be heard. EDS awareness saves lives. Even though I think it should be a unicorn. We need something to go viral, like the ALS Ice Bucket Challenge.
By taking the ALS Ice Bucket Challenge, I'm going to challenge 3 more people. Elon Musk, Ryan Seacrest, and Chris Anderson of TED. Consider yourself challenged. You have 24 hours. Good luck.
My idea was to have people go on crutches for a full day, 24 hours on crutches. And then if they recorded themselves trying to do things on crutches or even just trying to take a video on crutches would be kind of hilarious. There might be a lot of broken phones though, but it would make for good social media clips and it could get the word out there. We need to get people to pay attention to Ehlers-Danlos. Ehlers-Danlos deserves to be heard. Let's hear EDS roar, or more like neigh, because we're zebras. Okay, that's gonna need some work.